Good afternoon. My name is Brandon Figueiredo. I'm one of the SRNAs at the University of Southern Mississippi's Nurse Anesthesia Program. It's DNP. Today I'll be talking about the laparoscopic approach to surgery and how it's been associated with improved outcomes, especially when contrasted to the outcomes of the traditional open procedures in terms of faster recovery, less pain in the post-operative phases of care, less tissue deformation, and even in many cases, less morbidity. But despite the shortened time to recovery and overall better results when compared to the open laparotomies, the increased peritoneal and referred pain can be associated with an increase in the laparoscopic approach as a result of the more irritated peritoneal cavity due to the effects of the desiccated carbon dioxide gas used for the pneumoperitoneum itself. The numerous attempts of controlling this is increased pain with irritation that's been made using a variety of the different pharmacologic agents and methods due to the fact that there are so many advantages to the use of the laparoscopic technique. Preemptive, I should say, administration of analgesics that work through modulations of the phase of pain transmission, which is at the tissue level itself, has been used before to both control the post-operative pain and also minimize the intraoperative and post-operative opioid consumption. And through that, you minimize a lot of the untoward side effects of the opiate administration in the perioperative period. At the local tissue level, the tissue inflammation itself is often accompanied by release of pro-inflammatory cytokines, which can sensitize the nervous system. And as a result of that sensitization, you get a type of hyperalgesia in the post-operative pain period. And that's especially a problem with chronic pain patients in the recovery room. So an alternative to those large doses of narcotics, I'm proposing in an effort to reduce post-op pain and speed recovery is the preemptive administration of IV lidocaine infusions in patients where there's no contraindications to lidocaine and who are also undergoing those laparoscopic intra-abdominal procedures. So lidocaine's both has analgesic and anti-inflammatory properties, as well as it controls the hyperalgesia that we talked about a minute ago. Other benefits is that lidocaine has been around forever. It's relatively cheap. It's not controlled substance, so any RN in the PACU area can administer it without it being in a locked infusion box. My project's an integrative review of the literature where I'll be completing a white paper proposal where I'll be disseminating that idea to practitioners in the clinical setting locally. Anticipated outcomes of my project are lower narcotic requirements as well as decreased pharmacologic side effects of the large doses of narcotics. Also cost reduction. Lidocaine currently is 1/10 of the cost of per cc ratio to fentanyl, which is the most popular opiate analgesic in any anesthesia care team, as well as better pain control, especially to patients with those polypharmacy exposures like chronic pain. Thank you very much.